Parte positiva é você trazer qualidade de vida para as outras pessoas, é você se juntar, ter mais força. O coletivo ele é muito poderoso, né, para ir em busca de direitos e trazer assistência, trazer qualidade de vida para as famílias, não só para os seus semelhantes, mas são pessoas que vivem a mesma realidade que você, são minhas irmãs de luta, como a gente se considera. Isso é de um valor grande, né, porque o retorno, muitas vezes, que a gente tem são os benefícios também para si próprio, porque eu lutando pelo meu filho, eu atinjo mais de 500 crianças no estado de Pernambuco.
So the parents have formed, particularly the mothers, very, very close networks supporting each other and providing information to each other about Zika. And it's a very trusted source. So many of them are informal, like WhatsApp groups, or more formal, where people come together and meet. And this has been very important to provide social support to the families and also to provide information and guidance. So it's been really, really critical. In the parent support program that we've established, we get the parents together, about 10 parents, once a week for 10 weeks, and we give training on different kinds of topics like feeding, communication, play, but also things like what are your rights and how can you access those rights. And that's been really crucial to help support the families in how to best care for their children who have often very complex needs. So it's been really, really important, these kinds of interventions.
Yes, social movements is really important. In Brazil, our national health system included as a principle social participation in different levels of the country. So in the federal level, in the state level, in the municipalities. So we stimulate social participation and social movements to engage to social policies, to health policies. So this is very important and crucial in the times of epidemics. So after the Zika outbreak, disabled children especially became invisible to our authorities. But now, when Zika epidemic is over, so they getting invisible again. So we have to stimulate and to talk with the authorities, and social movements are especially important and crucial in these policies.
I think that they are extremely important in the sense that there is a huge issue in Brazil, which not only in Brazil but in many other countries, that there are some insufficiencies in terms of the public healthcare provision. There are insufficiencies in terms of the support networks available for families with long-term problems, for example, families and children with disabilities. So there is a gap. There is a problem there in terms of providing adequate, sustained, affordable, and high-quality care for these families. So. And this is in part the consequence of resource and funding insufficiencies in these systems, but it's also a matter of acknowledging that these families and these children have the right to adequate health care. So these movements are very important in the sense that they are advocating for rights.
Os valores positivos que a gente tem é a conquista de ajudar mais mães, né? Ajudar mais a comunidade em si, nas cidades do interior que tem menos recursos, para a gente ajudar assim a levantar e levar essas mães mais um pouco para frente junto com os filhos.